Welcome back to Surgical X. Today's topic is knot tying, hand techniques specifically used to tie knots in surgery. First technique will be the two-handed technique for knot tying. The second technique is the one-handed technique for knot tying. And the last one, a bonus technique, will be instrument tying. My name is Paul. I'm a certified surgical first assistant. Before we get started, I just want to say thank you to all the new subscribers. I appreciate you. I appreciate your comments. I will work on some of the things that you pointed out in the videos. And yeah, thank you. Special thank you to Mr. John Suss in Chicago, my first subscriber. So thank you, John. Two-hand knot tying, which will be demonstrated with our rainbow paracord. Today, I'm not going to use the one that I colored black because it was making my fingers black. This thing was turning my fingers black and it was kind of discoloring the other end. So anyway, that one's out. We're just going to use the plain rainbow one. I apologize, but I think we'll be able to follow and we'll be able to make sense of what we're doing here. Okay, so two-handed tying. We're going to start by crossing our legs. Okay. I have in my left hand the leg that's on top, and in my right hand the leg that's on the bottom. If I hold it up this way, you'll see that this one is further away, this one is closer to me. And I'm going to start with position 1. You can consider these as having two different positions. There's going to be the index finger position, and there's going to be the thumb position. We can call it position 1, position 2. So position 1, we're going to focus on some terminology here. Let's call it loop, pinch, push, pull. Loop, pinch, push, pull. I think that's, I just made that up. Loop, pinch, push, pull. All right, so loop. How do we make a loop? We're going to wrap this one the opposite direction around my hands, and we can see the loop here. We made a loop. Next, I'm going to pinch my two fingers together. I'm going to push them through the loop. Now I'm going to move my hand down so you can see what I'm doing. Then I'm going to pinch this leg in between my fingers, and we'll pull it through. Okay. Now I can drop that down. That was position 1. Right? This was position 1. Now we're going to move, since we just have a half knot here, we're going to move from position 1 to position 2 and create a square knot. So again, loop. I created a loop. You can see it there. I'm going to pinch, push through the knot or through the loop. Grab it right there, pull it through, and grab it from the other side. Now, you can see that there's an X there, right here. That's not going to lay down nicely, so what am I going to do? As I drop this down, I'm going to cross my hands. Normally, you don't want to cross your hands during surgery, but this is a time when we do. So what we have there is our square knot. Our two half knots created a square knot. And that's two-handed tying. We'll do it once again. Position 1. Over to create the loop. Pinch, push, grab it there, pull. Throw it down. Position 2 is my thumb. Make the loop, pinch, pull it through. Grab it, pull it back through, and tie it down. Now you can see we have a series of 2 square knots. You getting that? See it? Okay. How about one-handed tying? That's the next one. One-handed tying, as it implies, is mainly going to use, we're going to use both hands, but we're just going to focus on one of them as the active hand tying the knot. So if I have my two legs here, I'm going to use my right hand as the post, and my left hand is the one that ties the knot. Okay, so first I'm going to start by crossing them over. Here's my post, and my knot tying hand is closest to me. Okay, now when we start this one, let's start it with, let's call this one position 1. I have the tail sticking in this direction across my fingers. I'm going to lay this down across to create the loop, right? Now we have to pull this leg through that loop. How do we do that? We're going to come underneath and pinch it with these two fingers. So that's my pinch. Now I'm going to pull it through and tie it down. There you have a nice little half knot. That was position 1. Position 2 is going to be like this. I have it here just like we did with our two-handed knot, but this time I'm going to slip my thumb underneath and create space here, space there. I'm going to put this post, this one that's we called the post in my right hand, I'm going to put it over here. Now I got to get this leg through that loop. This leg's got to go through the loop. How are we going to do that? I'm going to come down with my index finger, grab it, and rotate my hand, pull it through. Just like that. Again, here's position 1, pull it through, down. Position 2, pull it through, down. That is one-handed technique and two-handed technique. Why do we do the one-handed technique? A lot of people are comfortable with it. It gives you a nice tight knot. Not that the two-handed technique doesn't. In fact, you might want to use the two-handed technique if you're working on really delicate tissue that you don't want to pull on the post with. And let me demonstrate that by tying 2 knots in the same direction with the one-handed technique. Okay, so I've crossed them over. Let's do position 1, throw it part of the way down, and we'll do position 1 again, and that's part of the way down. And what I've created is more of a slip knot, not like the band, like the knot. So we slip it down. I'm sorry about the focus. I know I'm jumping in and out of focus, as Eric from Indiana has pointed out, but we're working at 2 different levels here, and I apologize. So deal with it, Eric. So if we tighten this up, we can see that it'll still slip up and down because I threw 2 in the same direction. This is where the post is important. Now if I just push on the knot, it's not tightening it. What I really want to do is I want to pull on that post. All right, I want to hold that knot in position, pushing it down, and I want to pull back on this post. I'm pulling back on that post. Okay, and then I can come back with position hand technique number 2 and lock it. Now that's nice and tight, but you can see where the tension from that post would be difficult on delicate tissue, and you want to use the two-handed technique. All right, up next, instrument tying. The one-handed technique is very common, but you're not going to want to use that if you're into some delicate tissue where you can't pull back on that post and throw your knot down because you'll tear the tissue. You'll want to use a two-handed technique where you can just guide that knot down gently. Okay, next. For instrument tying, I got this nice suture demonstration skin and a piece of nylon that you know what, this is really hard to see. This is really hard to see, and really we're going to focus on hand technique today. We're focusing on what's going on with our hands, not so much what's going on with the knot. So in that spirit, we're going to go back to our trusty coffee mug and our good friend, Mr. Rainbow Paracord. Okay? So let's pass this through. Let's pretend this is our needle driver. This is our needle. We just put it through some tissue and pulled it all the way. So we just have a little bit of tail sticking out there. Next, I'm going to take my instrument. I'm going to wrap it around in this direction, going from left side to right side over the instrument and back around. Then I'm going to grab the tail. I'm going to pull it through. And now I've moved that tail, which was on the right side, to the left side. Right? I'm going to do the same thing. I'm going to put my instrument in the middle. By middle, I mean between this left leg and this right side. I'm going to wrap the instrument around. I'm going to wrap the cord around the instrument. Grab the tail, and I'm going to pull that over back to the right side. See that? I've made a square knot. Now realistically, oftentimes we'll throw a surgeon's knot for that first one, meaning I'm going to wrap around twice. I'm going to grab the tail. This thing's a little sticky with this paracord. I'm going to pull it through. In the center, wrap it around, pull that tail back to the other side. I'm just wagging that tail back and forth. Grab it here, wag it back to the other side. Do it again. You could throw as many as you like depending on what you're doing. There you go. A series of square knots starting with a surgeon's knot. And that is how to instrument tie. Now, when you see practitioners instrument tie, you're not going to see them stop and put their instrument between the knot or between the legs and wrap it around. And they're going to be doing it in the air in certain directions, out of position, and it might be hard to catch up. You might even see them not do it correctly. You might even see them not tie square knots. It happens. Does it work? Yeah, it works. I guess the question is it really doing the best that you can do? I mean, you see that a lot in healthcare. People do, just enough to get by, or they normalize their practices and say that, they've been doing it that way for, 10 years and they ain't never seen no wound open up. And yet it happens. Just ask yourself, what do you want to do? Do you want to do the best job you can, or, whatever. So there it is, knot tying. Hand techniques used for tying knots in surgery. Thank you once again for watching. Send me your comments. Please subscribe. I appreciate it. Please take care of yourself. Please take care of your patients. And please do the right thing every time. Thank you.